Started.
Awesome. Alrighty, so thanks for everyone for coming and listening in tonight. So today we're going to talk about acing your medicine interview with a focus on we're going to look at both UWA and Notre Dame specifically for postgrads. So in terms of what we're going to do today, we're going to look at what different types of interviews there are. Now the main ones for UWA and Notre Dame are the MMI, but for those of you who are also sitting interstate exams, we're going to just talk about the panel interview and the group interview as well. We're going to think about what an ideal candidate is and different sort of question types and formats, how to prepare, and within those formats and question types, we're going to look at a few examples and then we'll just wrap things up. So before we get on to it, let's talk a bit about each other. So my name's Maya, and we're both UWA. Kaylee and myself are both UWA students in second year, and my background is that I came from a Bachelor of Science, and I did biochemistry and molecular biology. And Kaylee,
Yep, so I did the BPhil at UWA and I did biomedical sciences, and then I did an honours year in medical research.
okay, so if we go on talking about what the medical interview is looking for. So the reason that you're sitting this interview is up until this point, I guess the way to think about it is everything you've done has been numbers and you've been statistics in a way. So now it's your chance for the interview panel to see you as a person. And this is exciting and scary bit, I guess, where it's like your job interview into medicine. What they're looking for, they're looking for the best, they're looking for the right students. So for what they think you're going to do and you're going to do well in medical school. So the interview itself is quite heavily weighted. It's usually 33 to 50% of the overall score, especially at UWA Notre Dame. It's quite heavy. And the focus for us for these two unis is the MMI, but we'll also talk about the other two. So is there anything else you want to say on there, Kaylee?
No, other than that, one of the consultants in one of the hospitals I spoke to was saying that prior to the introduction of the interview, apparently students were getting sort of weirder and weirder every year. That's why they decided they needed to do something about it by introducing the interview. So,
Yeah.
yeah.
Yeah, I think I've heard people just say they want to see you also be you. You're a person. They want to see who you are. You're not just the study that you do for the GAMSAT or your marks at uni. And that what med school will teach you all the science and they'll teach you all the skills. You need to have some of the soft skills in that thing beforehand going in because they're harder to teach. So the important interview format for UWA Notre Dame is the multi-mini interview. So it rotates about 5 to 10 stations. I know at UWA, for doing correctly this year, it's 8 stations. There's different statistics on the next slide. So for the short scenarios, you do about 5 minutes per station. UWA it's 8, so it's a little bit more. And the scores are based on the appropriate of your response to your stimuli. It doesn't have to be right. It just has to be appropriate and structured well. I think that's a big thing I want to emphasize is that you can have completely opposite opinion to someone else who's presenting, but it's how you structure using your format and presenting that comes across to the interviewer. So in terms of why this works really well, if you perform poorly in one station, I was talking to Kaylee about this before, you can move on. You get a clean slate every time you walk in that door or go through that different group room in the online format. And they do not interfere with each other. So there's a different marker in every station. You get blank new person. And this last line is very interesting. It can be fun if you look past the stress. I guess you get a new chance to show someone new why you want to be in medicine every time you're in this. So any comment on that, Kaylee?
Or with the fun thing, for some reason, what was going through my head is it felt a bit like challenging the Elite Four in Pokemon, where you kind of know like the general theme of what you're going to go into, but you don't know the specific challenges until you actually walk in the door.
Such a good
I know
analogy.
it's a bit sort of silly, but
Yeah.
that was my
So
way of looking at it.
yeah, and the biggest thing is the one of the advice that I think is most people bomb their first station. So I did. I walked in and I just walked out of that room going, "Oh my gosh, I didn't know what I said. It felt like word vomit." But you stop, you move on, you can wipe your mind and you got to keep going. That's the biggest bit of advice with this type of interview. If you ruminate and you worry about what you did before, you're impacting your chance of what's going to happen next. It's easier to say, and this is something you do in your preparation. Practice moving on. But also, when you're practicing as well, make sure you stop and actually fix what could have happened. Alrighty. So let's have a look The next kind of interviews, Kelly, do you want to explain panel
Sure.
interview?
So the next kind of interview is the panel interview. Now, there's not a lot of universities that use this one anymore. I think it might be just Flinders. So this is the type of traditional interview where you have a panel of 2 to 4 interviewers, and basically they're the ones who are going to ask you all of your questions. And they might also have some scenarios for you to talk about as well. And then just like the multiple mini interviews, they ask for you based on how appropriate your response is. They're not marking you based on is it right or is it wrong. There's advantages and disadvantages of this method as well. Um, so advantages, you only have one set of examiners. So that could be an advantage if you get on well with them, or it could be a disadvantage if you don't. Another potential disadvantage of the style is that the adjudicators' opinions, because there's multiple of them, they could influence each other when they're talking to each other about what score to give this person. And because you're with the panel for a longer period of time, you do require some more in-depth answers. Now they've got here interviewers can play bad cop, good cop. So I suppose also the multiple mini interview, you might get some examiners who try and ask things in a sort of weird way to try and put you off or make comments and stuff. Um, it's just something I guess you have to bear in mind, that something that could happen when you go in.
Yeah, and the thing is though with the examiners and what's to be aware of is there's I don't think there's many examiners, if any, that want you to do badly.
Yeah,
Most of the examiners that I and had, they said at the end of them, we want you to do well. They want you to succeed and give your best answers. So they're on your side,
yeah,
whether it's a panel, whether it's an MMI or anything. So, and with the MMI, the reason they've done that over the panel is it's more standardized. So there's set ways so that the examiner will often ask you a question and then they'll might prompt you, but that might just be a standard prompt. So don't feel the need to keep vomiting out words if they prompt you. If you're happy with your answer, stop with that bit.
yeah.
Anyway, we'll
I
get
found
into
that
that.
the interviewers at UWA were pretty nice, but I think like at some universities they have things like role plays and stuff like that. So you might have someone who's role playing someone who's not a nice person.
Yes,
So
and that's
that is something that
particularly,
you
yeah,
could end up
just
getting.
particularly important for Notre Dame. So Notre Dame more is a focus on UWA likes to chat around a scenario. Notre Dame has a focus on they will put you in the scenario. They will put you in a room with an actor or a stimulus that you need to discuss and actually take out the scenario. So if we keep going, the last sort of one they've got is group interviews. Now this is ANU does a group interview activity. I think this is the most terrifying, and this is just mean. But anyway, you get a small group of students who are interviewed together, and it's about how you problem solve with each other in a small group thinking session. So, for example, yeah, like how to put together a task or complete an activity. The thing with these, though, you can be overshadowed by big personalities. So I remember when I started this, if you've ever done a group interview for a job, they're absolutely terrifying, where you go in there and these people with big personalities just overshadow everything. But having said that, that in a weird way, that's a bad thing because the interviewer will see that and you see you take over a situation. How you interact and how you balance leadership and also delegating roles is really important. And that's the thing to remember with these. Is there anything, have you had any experiences with a group interview, Kaylee?
No, not at all.
Yeah, they're just remember that it's about holding your ground. You have value to contribute to the group, and never forget that, and know your role. Because if you stick to your role and you understand and communicate, they're all the skills that make up what medicine's all about. So let's have a kick. And so let's have a look at the really specific stuff for 2020. So in terms of us, we're concerned with UWA down the bottom here. So number of stations for this year, interesting, it's 11 minutes. So they've gone a bit longer. And the time between station is 2 minutes. And with UWA ethical scenarios, why you want to be in medicine, we'll talk about that question. Can be a good and a bad thing, that one. Your health knowledge. Yes and no, so there's that one there. Behavioural questions, so to do with your own personal qualities, and practical tasks you can do in there. And so that forms in that session something called the graduate presentation exercise for UWA. which, Kaylee, do you want to explain what that is?
Well, we can't really say too much about it because we did have to sign non-disclosure agreement.
Yes.
But basically, what it says on the box, like, you have a station where you have to give a presentation, basically, and they also give you some prep time as well.
Yep.
There's information about that on the WA's website.
Yep. So it's a little bit longer, and you will be emailed out information if you do have a UWA interview. You would have already gotten information about that. In terms of Notre Dame, so what they do is they have 8 stations and it's the 6 minute. They're shorter. So they do ethical, why medicine, your health knowledge, behavioural, but they also, the biggest thing is actors. Role playing, pictures, videos, scenarios is what they throw at you. So when you're doing these, it's really important when you prepare, don't just talk about what you would say, do it and actually have someone be that actor. Okay. And then for if you are having any going to any other universities, all the information is on here. And most universities will send you out a pretty detailed information thing beforehand, so just read that really carefully. Okay. So let's talk about what they're looking for. So what qualities do we look for when we're doing medicine? So you've got to work in a team. And the way you assess that could be you talk about that with your behavioural question. You think about how you worked in a team before. Your communication. This whole interview exercise is about how you communicate. So that's being assessed non-stop throughout. Culturally sensitive is really, really important. And so you're going to come up through ethical scenarios, and it's really important to consider all views and all different ways that people could experience something when you approach a problem. Effective and competent, you've got to be good at what you do. But again, I think the best way to do that is practice. So with the interview, it's all about practicing this skill. Interviewing is a skill, and they talk about going for job interviews. It's not something you just rock up and do. Some people can, most people can't, and that's fine, and that's why we practice. So I'll just give a word. The way I prepared for this interview, I treated it like a full-time job. I prepared 4 or 5 hours a day, most days a week, to prepare for this interview. It sounds like a lot, but what I will say is this is your chance to get in. Don't do it by halves. So if you can take it, I put uni on hold to do this interview and it paid off. So go for it. And then the last sort of one is able to process and deal with really complex emotional situations. That's empathy. Empathy is one of the biggest things we are taught in med school, and it's one of the biggest things that comes across. It's, I guess, in a way, it can be feels like it's hard to learn, but just there's so much research about empathy. If you have a look up and just actively listening and questioning your own conscious and what you're saying and how you're acting is a really good way to think about how to be empathetic. So you need to do this in every single question. Sounds like a lot, but that's what they're testing. So were there any ways that you found you could do this, Kaylee, in most questions? Or is there anything else that we've missed?
I suppose it's just all about just showing that you're a person outside of studying.
Yeah.
I can't say that I was thinking consciously about putting all these things in all of my responses when I was answering them. I think I just tried to come across as sort of like just being a genuine person.
Yeah.
But being a genuine person, I probably did show like, empathy and ability to communicate,
Yeah. It's
etc.
being genuine. I think that's a really good word to have at the front of before going an interview. Is the other thing is we can talk about preparing, but when you get in there, don't have prepared answers. The examiners are there to pick them out, and that's like a big red flag for them. It's no, because you've sat in there, you've not. Again, it's about being genuine on the day. So you can prepare, but it's preparing by learning the skills to give an answer on the day rather than just rote learning an answer is what they want you to do. Yeah. So I think the biggest one though is the bottom one is empathy. And also I probably think team play is hard to show in a lot of them. I think that's going to be showed more specifically in some stations. Cultural sensitivity as well is a lot for ethical situations. But again, it's every answer you give, just consider beyond your own experience of what you are. But the last number 2 and number 5 are particularly important. Okay, so do's and don'ts. So the strong candidate dresses appropriately. So what I'm wearing today is what I wore in my interview. So wear, don't go over the top in terms of you don't have to wear a suit, I guess, like a tie, a suit, all over that, but also put some effort in. It's
Be
really important.
comfortable.
Yes. Put some effort in, but be comfortable. So I deliberately didn't wear a dress because I felt more comfortable wearing pants so I could move a bit more. But the other thing as well is that I decided to wear black and then I wore a bit of color because at the same time I wanted to come as professional, but also it's more memorable and it's also a little bit more relaxed in a way that to have a bit of color in your outfit. That was weird. One person that gave me that advice was like, wear something, but wear something on you that's memorable, and yeah, wear something that you feel confident. And so I guess for guys that can be pants, it can be a shirt, doesn't have to be a tie, but it's neat. For girls, it can sometimes be a little bit harder. So wearing a blazer, but wearing a dress can be a way to go. Anything else you would add, Kaylee, with that one?
I think I just wore a blazer with a dress during my interview.
So I guess the other thing as well is don't pick it out on the day, have it prepared. So have what you're going to do, take everything out that you can control and plan it beforehand so that when you wake up on the day, all you're doing is sitting there going, all I have to do is the interview. What I'm wearing, my makeup, hair, anything else I'm getting there is done and sorted. So the next thing, introduce yourself professionally to the interviewers. Have the confidence to say your name and who you are and say hi. So, hi, my name is Maya. And then walk in and say hi and then sit down. And yeah, having said that, articulate yourself well. You're going to be so nervous. And the best thing to do, you've got to hold your nerve when you get in that room. You've got to use techniques where you slow yourself down when you talk. I'm a speed talker and I know I still do it. I'm probably doing it right now. And so the best thing you can do is consciously listen to how you say things. And the other thing is watch out for your hands. I'm a hand talker. And the biggest thing that I had to practice was sitting on my hands when I did this interview because it was doing this was too much. And you want to get very excited and get very nervous, and all your nerves come out in your hands. So look for your quirks is the biggest thing. Do you twirl your hair? Do you rocking side to side? So that's what you can pick up on. And then, do you have any other of those little quirks that you had, Kaylee?
I've got a lot of quirks, I guess, but how I control them is a different thing.
Yep.
My probably my Achilles heel is saying like all the time as a substitute for
Yep.
Typical, I guess, millennial thing to do.
It's those filler words. You've got to untrain yourself to stop you and just get them out of your vocab. So, and the last one, approach the question using a framework. So this is what I come back to. Don't prepare a rote answer. Have a strategy in place to answer on the day. So for example, the biggest one, when we do things like behavioural questions or things about yourself or situations, there's a mnemonic called STAR. So it's situation, task, action, and response. And you use those 4 bits as a way to guide your answer. Okay, and then what to avoid, so gesticulation, throwing your hands, doing weird quirks and things, just, you can hand talk. There's a way, it actually shows that, you're not just a robot sitting there, but it's about having it controlled. The other biggest thing is take a breath when you walk in. Don't launch straight into a scenario without thinking about it. You can pause for 10 to 20 seconds and just focus your thoughts, think about what's the first sentence, your topic sentence is going to be. So do you have any examples of that, Kaylee? Or any other things to add from that one?
I think the other thing to add is that when you're pausing to think of something to say, it feels like it's a very long time to you, but to the other person watching you, it probably doesn't feel like that long at all.
Yeah.
The other thing as well, a lot of people will probably be thinking about what to say before they say it. So if you have to do that too, it's not going to stand out in a bad way.
Yeah, it's just collecting your thoughts and then being able to speak. It shows that you're not just blurting out the first thing, you're considering options. So the next one, don't go for water if you're shaking. this was a big one. I was so nervous. I had a tremor on the day. I still remember it. Don't reach for that water and spill it. It's something like it's very specific, but
There's
yeah,
a
it's
really good story about this on Paging Doctor. Some people were just talking about the things that they did at their interview, and
yeah.
someone said they went to get the water. They like picked it up, and the water spilled like down their shirt,
Oh
and
Jesus, no.
maintained eye contact with the examiner the entire time.
That's good. Yeah, make the best out of a bad
So,
situation. Yeah. And the last one, I think the biggest one on here, don't memorize questions. Don't. Just as much as you want to and you think it's helpful, they know. They know, for example, why do I want to do medicine? I want to do medicine because blah, 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 blah. It is rehearsed. They've heard it and they've seen it before. They don't want it. They
it also,
don't want, yeah, yep.
sorry, keep going.
I'm just saying they don't want robots. They want real people.
Yeah.
Yeah.
The other thing as well, I think a lot of the med schools write questions that you won't necessarily think of straight away. So they're generally won't going to ask, they're generally not going to ask you, why do you want to do medicine? Because that's a question that's way too easy to predict and way too easy to prepare for. So if you prepare responses to questions, chances are those questions are not going to be asked because the unis are trying to develop questions that people have not been able to prepare for.
Yeah, that's a good point. Okay, so speaking of questions, if you guys watching do have any questions, feel free to go on the video chat and put them down the bottom as we keep going through. So question types. So the biggest one, I think the one that's most well known for this, is talking about ethical scenarios. And what they're looking for with these is your problem solving and your knowledge of issues of what's going on. So it's about discussing what's happening and then coming to a solution after you've considered all the facts. So these can be the hardest to approach, but they can also be the ones that you can practice. So you can Google MMI ethical scenarios, go to UK, American, any website, just do as many as you can. Because it's about practicing how do I do the problem solving approach in my head. The next one, in terms of motivation to study medicine, again, like it says that you know this one. So why do you want to be a doctor? Be genuine. Be genuine. Don't just say, oh, I'm going to be good at it. Oh, I like helping people. It might be the answer, but it's not the reason why you want to do it. Get specific and get to the reason why. So it's about articulating yourself. Any comment from that one, Kaylee? Or the ones we've done so far?
Not really, other than that, the ethical scenarios, that's, like it says on the slide, it can be the hardest to approach, but there's also plenty of frameworks that you can use to approach ethical scenarios. So there's probably a lot of frameworks you can find on Google that will help you with that. And with the motivation to study medicine, again, that's one that you're not going to be asked, why do you want to be a doctor? You'll probably be asked it in some different kind of way. So it's not just about trying to understand yourself, like why you want to be a doctor, but it's just trying to understand yourself sort of like as a whole, and understanding how you feel about other issues relating to you and medicine, if that makes sense. We'll go into more detail on these. We've got some practice questions coming up, so we can go into more detail talking about strategies and ways to approach these questions.
Yeah. The next one, not commonly done at Perth unis, but it's called science knowledge, the DTEC ones, where you have to explain a scientific term or concept in layman's terms. So we'll show you an example of that soon, but it's a good way to pretend you're explaining to family members who've got no idea what's going on. It's about gauging your understanding and teaching. And then the next one's a health knowledge. So these stations are designed to test your understanding of health issues in Australia and complex ones. So thinking about Googling what are the top 5 health conditions in this age group right now in Australia. Some of the biggest ones are, so I'm not anything from the interview, but just thinking about the list right now, what we're learning. Mental health, huge. So it's something to definitely consider, particularly now with COVID. You guys have an ample opportunity to answer things about that. So I'd be getting onto things like the health report done by Norman Swan as a podcast is a great source of what's happening in health knowledge at the moment. So onto following experts who are doing the science research at the moment, and health communicators is a really good way to keep up with what's current. Public health, which is bigger than ever now. So that one's definitely a possibility. So we've got behavioural questions, so who you are. So these are the ones that are kind of more classic job interview questions. So leadership, your ability to communicate, when did you show an example of empathy, or an example of a time you failed. That was one I dreaded wanting to answer. So, so use star. This is what I was talking about before. The star format comes up. So practice puzzles. There's so many. It's really hard to condense down into one type, but just a practical task you have to do in the room. So it's talking about negotiating lead, being part of a team. These are often done in the setting of the group interviews, and then that's leading on to group work. Special for ANU before the MMI, and they're divided into groups. Okay, so let's get into some of this. So the first one we've got is the ethical scenario. So this is an example. So a friend has told you that she's pregnant and that she hasn't told anyone else and will possibly seek a termination. One day in class, she becomes unwell and your tutor asks if she is pregnant. How do you respond? So you breathe for a minute. The first question, generally not what would you do, it's actually what are the issues. So if you think about this, this is again related to medicine, why they're asking it, because it's related to confidentiality and a patient's right for you to not disclose their information if they don't want to. However, this is not in a medical situation. So you could say in a medical situation, this is what the law, this is what the information would be. But your friend, again, it's your friend, and it's about knowing your trust and your confidence in them. And so you can also, what they call shifting the goalposts with these ones, saying, we actually don't know, did she plan this pregnancy? Is it well controlled? How many other people has she told? Are all the sort of things you'd say for this question. So a paramedic attending to her asks if she's pregnant, do you tell him? Again, give a yes or no. When they ask, do you tell him or not, actually give a yes or a no. So for this one, for example, I would say, I would tell him, because I believe that in terms of a medical situation, the paramedic has a non-disclosure. They would not breach the confidentiality. And so I feel safe to do so if it's going to save her life. And you say why. The girl's mother calls you the day after the incident and asks if her daughter is pregnant. What do you answer? Now, what do you answer is different to do you tell is different from the last one. It's more open. This one's really hard because, again, it's going to be based on how well do you know the mother, how well do you know this friend, how confident you are in the mother's, what's the consequences that you do or don't. Will this mean that what's going to happen afterwards? That's what you need to consider in this problem. And then the girl has decided upon termination. How do you respond to her? And the thing is with termination, I guess, in a medical scenario, for thinking back to that, you need to think about it in terms of making an informed choice. So you need to think, so has she been given all the information, she's been able to make this decision, weighing up the pros and cons? If so, she can make an informed choice. And that would be how I'd answer this. Is there anything, I'm going over this, but I'm just saying that these are the sort of questions they're going to ask. There's going to be, what are the issues? Every avenue, explore medical, legal, explore just like socially and culturally is a really big one as well. What are, for example, is this in Australia? The termination that's legal compared to somewhere else where it's not. So again, broadening your cultural perspective. So is there anything I've missed in there, Kaylee? That was a very brief overview of a massive question.
I think you've sort of covered all the main issues. And also, I think like even if the question doesn't specifically ask what issues are involved in the situation, it's probably still good to talk about them because it shows that you've thought about it.
Yeah.
And that would probably get you some points on the little scoring sheet.
Yeah, that you're thinking broadly. Okay, so that's an ethical scenario. So motivation to study medicine.
Yeah, so as I was saying, a lot of times I'm not going to ask you right off the bat, why do you want to study medicine? Because that question's too easy to predict and too easy to prepare an answer for. So chances are they're going to ask you something that's kind of a little bit around the topic. So in this case, we've got, what do you intend to do if you do not get accepted into medicine this year? So of course, this is kind of like a personal question. It's going to change. The answer's going to change significantly from person to person. I suppose the key to this one is sort of understanding yourself and understanding your own motivations, like why you want to study medicine, what's important to you. what are your plans for the future, whether you end up getting into medicine or not. Um, so I've had some people ask me if they get a question like this, is it best to say, oh, I think I would do my plan B and I don't know, pursue a higher degree in something else, or is it better just to say, oh, I will keep applying and I'll just focus on that? Um, just like every other question, I think it doesn't really matter which way you end up going as long as you can talk about why and like back up your answer. Um, yeah, is there anything else you wanted to add to that, Maya?
I agree 100% with what you just said. If you say, I would keep trying until I get in, you need to give a reason, and that's completely fine if it's structured and logical. Same thing. The biggest thing I think with this is have a realistic backup, and I'm sure you guys do. I'm sure at this point, we're going into the interview. If this doesn't work, there's a realistic backup of what you're going to do next year and the time being, and talk about that, saying, this is my plan. I do intend to apply next year, but in the meantime, I want to pursue this, and say that you can kind of combine those two is a way to get around that topic. But they don't want you, yeah, I guess I don't go to the extremes like I would never try again or do this. It's having a rational, genuine answer. The other things you get with this are things like why don't you want to just be a nurse? Or it's not just being a nurse, whereas because what it is about doing different roles. A nurse has a very different role to the doctor in the hospital, and it places differently in terms of what they help out with patients. Why would you prefer to do allied health? Would you prefer to do dentistry or another area? Why specifically medicine? And that comes down to understanding what a doctor does and understanding their role in the health system. Because you can do all the same things. I guess nurses have more power in a lot of senses. And I guess if you're coming into medicine for the power, and some people do, which yeah, it nursing can do that. And they're often more skilled. Like I'm knowing now in hospitals, the nurses are more skilled than we'll ever be at this point. So it's having an understanding of the roles of people in the hospital and not talking down other professions saying, no, I have to be the doctor, I have to do this. No, it's actually saying the doctor is the person who is often the case manager, or they're the person who is the first point of call when a person comes to a GP. And they are then the people that then provide out to specialties like they need nursing care or they need this, and I want to be that person. That's a good way to talk about it. But again, if that's not genuine for you, can't say that. So have a good think.
Also,
Yeah.
I suppose the other sort of factor to think about is you also might need to demonstrate that you've really thought about going into medicine and you've thought about the challenges that you're going to face, because in getting into medicine is one thing, but then there's also like, you've got 4 more years of study at uni. After that, you've got internship, you've got like all these other years of specialty training. So you've got to think about how you're going to cope with all the challenges that are going to arise during that time. Um, that's certainly another thing that I could ask you about during the interview.
Yeah.
I guess
That
it's about thinking, making sure that you've thought about, why you're doing medicine, why medicine specifically, how are you going to cope with all the challenges that are going to arise out of it. Um, do you have a backup if needed? Those
yeah.
kinds of questions.
Yeah, that's what to look at. Okay, so let's talk about the D-Tech ones just really quickly. So, for example, they're like explain in simple terms what a cell is. And a good thing, I think a good thing to do with these is and what we do when I do tutoring classes, is use metaphors, but use simple, common metaphors. So, for example, you can say, for me, I think a good way to imagine a cell is that it's like a city. So, in a city, there are certain buildings and different institutions that each have a role, and each of the organelles are like each of those in a cell. So, for example, I'll give you 3 examples of organelles. So, you've got the mitochondria, my favorite, is you can say it's the powerhouse of the cell. It's literally a powerhouse. So, say that in your answer. So, go, it's a powerhouse of a cell. It's the factory that keeps everything running and generating electricity, which is like ATP. The second one you could show is that the nucleus is like the parliament, or it's like the library. It's a parliament and a library of information where it holds the DNA, but it also dictates the roles of everything else. And the third one could be things like microtubules, where you could say that the microtubules are like highways, where they carry along the mechanical parts of the cell that can perform functions. And then you can give a closing thing to say that, like all cities, they don't exist in isolation, except now. So what you can think about is that a city forms a part of a country or a continent when it forms a tissue or an organ. And that forms the world, which is your whole body. And it's a way to round everything out. So that's what a DTEC is. Take the stuff that, the best way to practice these is just take the stuff you're learning at uni or things that you're doing outside your course that you read and talk to someone about it. And get them to be critical and say, I didn't get that, and that metaphor was stupid. Like, Maya, that was dumb. Don't say that it's a city, choose something else. That's get genuine feedback for these ones, because it's really, don't just get someone that'll go, yeah, that was great. And then you have it back to you, they go, oh yeah, I didn't understand anything. You want to be able to have them communicate it back to you. All right. Any other good metaphors for this one, Kaylee? Because there's a few you could do
Last
for
year
the
when I
cell.
gave this presentation, someone compared a cell to a house, and or the organelles being like appliances in the house.
Yeah, it's another good one. It's a collection. It's almost like a team, and everyone in this, it has to work together. But there are lots of other ones. For example, you could say, explain. I'm a chemistry tutor, so explain to me what redox is, or reduction oxidation. You could say an electron's grabbed and an electron's pushed away, and it's talking about using just simple terms.
Yeah, I
These are the
suppose.
most fun. Yeah,
Yeah,
these are the most fun, I reckon, these questions, because you actually get to talk about things that you like, and also way it shows that you're really passionate about a medical topic, for example. And it's a good way to show if you're going into medicine because you really love the science and the research and the curiosity of it. It's a good question to do.
I suppose one way you could practice this one as well is you could like if you're still at uni, you could try explaining some of the stuff that you're learning at uni to friends or family members
Yep.
who aren't in the same field.
Yep. Okay. So health knowledge.
Yeah, so this is one of the practice questions we've got here. So what are some of the biggest challenges in closing the gap in healthcare outcomes between Indigenous and non-Indigenous Australians? So this is one, like as Maya said, it's good to have some background beforehand. It's good to try and read up on like news sources, maybe listen to podcasts and things like documentaries, all kinds of sources like that. Um, Obviously, you're not just going to be asked questions about closing the gap. You could be asked a question about basically anything. Generally, something a bit more topical because they do want us to be able to say something about it. And before I sort of start talking about this question specifically, I think one of the main things to keep in mind is not to get put off if it's a topic that you're not that familiar on. Even if you say, I'm not really sure about this, like, for example, I'm not really sure what the whole Closing the Gap campaign is, but I'm assuming that, Indigenous Australians must have worse health outcomes than non-Indigenous, and we're trying to correct the disparity or something like that, and then talk a little bit more about that. That's better than just saying, I don't know what that is, I'm not going to answer the question. um,
Yeah.
yeah, so
Yeah. These ones are tricky.
definitely, yeah, get as much information as you can. If like before the interview, if you get faced with a question you're not sure about, at least give it a crack. Don't leave a question unanswered. And then when it comes to talking about situations such as this one, where you're talking about different challenges, you can think of it. This is another question where it could be good to have a framework. So a framework that can work for a lot of health type questions could be sort of like the biopsychosocial model. So you could think about biological factors, psychological factors, and social factors between Indigenous and non-Indigenous Australians. Or you could think of it as like local, state, and federal level. Um, there's different frameworks you can have going in that you can use to tackle these sorts of questions. And probably if you look around on Google for frameworks for approaching health situations, you'll probably find a whole ton, and you can pick whichever one suits you the best. Do you have anything to comment on that, Maya?
Yeah, that was really good. No, the models that you gave are awesome. The biopsychosocial one, you would do that through medicine. You would do that forever. Be doing it, but it's really useful, and it's a good way to. It's also showing that you're not just thinking biologically. That medicine is about a whole person, and they so bringing up things like so another one with closing the gap. Closing the gap is one to really look at because it's really topical. It's really important. It's come up. There was a recent report that was released as well. To do with youth suicide between Indigenous and non-Indigenous, that they weren't reaching the targets. It's really important, and it's something that I guess you as future clinicians are going to be that this is part of your role. The other biggest ones definitely look at public health policy and to do with COVID-19. I think would be a massive one. Looking at science communication is massive. The way how we sort through useful and not useful information and what's fact and what's backed by science and how we actually get that to a broader public is more important than ever. And it's, again, part of your role. But again, if you don't know the topic directly, just you can say, I'm not familiar with the exact details of it. However, this is my understanding. And then, just like you said, Kaylee, that was really, really good. So, behavioural. So, these are your classic job interview questions. So, when was the last time you displayed leadership? And the best way to do these is that star response. So, for example, a good example I can give is so I did the Behavioural program too at UWA until I got accepted into medicine. I'm straight in. Didn't want to do my honours because I chickened out. So, an example of what I did is I was part of a Behavioural orientation group where every year, so this would be my situation. So, every year we get a new intake of students. And what we do is we run a camp to help them orientate themselves with uni and help the transition into their new life after high school. So, the task at hand was that the person who was meant to coordinate our orientation actually got very sick recently and wasn't and didn't leave us any of the materials. So we had to come up with a plan to organise an event called an Amazing Race in 2 hours. It was very stressful. So C and T and then A, what was your action? So the action that I took next was to say, so I stepped and I said to say, okay, so we have to put together this plan, and it was important that we delegated roles. So what I think is really important with leadership is not having to do everything and command everything. It's about delegating and giving people realistic tasks and a way for them to communicate back that you've completed them. And that's what I did. We had a role sheet and we had a way that everyone could mark off what they'd done. And then, my response was that we pulled it together and the students said it was one of the best things of the week. So it was great. So that's how I use the STAR framework when we're going through. So it's stick with that in your head and be really specific about, have I actually talked about the situation or the task? Because I found that quite difficult, where the situation is that I did an orientation camp and this was what was happening, but the task was that we had to do this specific thing in that. Yeah, it's like situations like the setup, the context. Task is what you specifically had to fix or had to show. Okay. Have you got any other examples of those ones, Kaylee?
I don't have any examples on me, but I suppose other similar questions could be like, when was the last time you had to be, loyal to someone, or when was the last time you had to display like a different quality than what's listed here? I suppose just having a few sort of interesting stories that could fit with multiple different types of questions and being a bit flexible.
Yeah. Yeah, for this one as well, a good one. So for Notre Dame students listening, you had to do your portfolio as well. Use your portfolio situations because you've already prepared your answers. You prepared in quotation marks, but you discuss those topics. So you can say, well, actually, I had this example of this thing that I showed. And it's a way for you to actually, this is where you can bring out all your qualities that make you perfect for a med student. Look at all the things you've done that you can show them. I think these are great questions to be able to say, look what I have to offer. So you can definitely use these. Okay. So, practical task.
Yeah. So these ones are a little bit weird. So the example we've got here is you have a pair where one person's given a drawing and they have to describe it to another person, has to try and recreate the drawing. Now they can ask pretty much anything really. Did you want to do it, Maya?
I was just saying I can be the second person if you need. And
Sure, do you want to?
yeah. So I've just the way I think maybe we should do it in a way that practice giving them instructions and then we can do it back and forth. So
Yeah.
in a simple drawing, so imagine we had like so for example, I've drawn a smiley face, and then I would say, okay, so I'm not allowed to say smiley face, but I want you to draw a circle on the page in the middle, and I want it to be big enough because we're going to put stuff in it. And then I'll wait for you to do it. We ready to go?
Yeah.
Yep, great. So what I want you to do is I want you to put 2 dots next to each other at the top of the circle, about 1 to 2 centimeters apart.
Yep.
Great. And then what I want you to do in the bottom half of that circle, I want you to draw a half moon, a crescent.
Mm-hmm.
Great. And that's it. So you should have a smiley face. And so it's your ability to, fantastic, sort of. He looks a bit interesting. But what you want you to do is, these questions remind me of that game. I don't know what it's called, but you're not allowed to say the actual word, but you have to describe something. So it's about
A
using,
taboo, I think.
I think so, and it's about using
Maybe
your
it's a different one.
language. This is like a weird version of taboo, but doing practical tasks, I'm trying to think of other examples. It could be anything.
Yeah, I think the main thing to think about with these ones is that they're not necessarily looking to make sure that you can do the task that they're asking you to do. They're assessing those qualities that we talked about many slides before this one. Stuff about how can you communicate. If it's a partner one, can you work as a team with your partner? Can you communicate well with them? How do you, like, are you good at like persevering if you can't get it right the first time? It's all these kind of soft qualities that they're looking for more than can you complete this task.
Yeah.
So that's something I guess to keep in mind.
Yeah, the soft qualities bit, and the way you said about persevering, I think that's important. So my smiley face didn't quite turn out well. I'd be like, okay, so next time, let's move the eyes down. So how would I describe that? In the top third, but not right at the top. So thinking about how you'd fix it. Because yeah, you don't have to get it right the first time, but it's about continuing. And it's also, for example, a bad instruction for that would be, all right, draw a circle, put 2 dots in it, and put a moon in it. It's like, what? It just went over your head. So being able to gauge with the other person and see, yeah, where they're at, and keeping and communicating clearly with them. Okay. So group work. So for example, with the group work with the ANU one, you could design an intervention to promote the importance of adequate sleep. So a way that you can think of this, I think what's important with group work is someone has to be a leader. Someone in that group has to actually step up and be a coordinator. Doesn't mean that, that's the automatic person, that's what they're looking for to everyone to be. But that person then needs to be able to delegate tasks to other people and organize it in a way where people's skills are highlighted. So for example, if the person is a design student and they're really good at drawing, that's your poster designer. And it's about them picking up and communicating and recognizing that. Or the person who did sleep science at uni, bang, there's your information collector. So that leader, that's one person. And then each person within the group, also if you are the other person, you contribute. Take ideas in, evaluate ideas with the group, go with the group. But also don't be afraid to include new ideas. And the biggest thing I think with group work is you need a leader, but you also need a timekeeper, and you need someone like a scribe to keep things going. So think about the roles that you would need in a group to make this work in time. Are there any other roles? So we've got leader who's coordinating it, timekeeper. What's the other one? You've got a scribe who's drawing it, and that could be the artistic person. You've got the people who are then contributing knowledge and ideas. What are some other roles that they have in groups? They often, if you've ever done groups where you've had to go to, I guess, work days, or you've had to go to uni orientation events, they love doing this sort of group work, and that's the ideas to draw on from these things. But in terms of actually in WA unis, these are rare in terms of a group exercise. But always, the skills and the communication skills involved are really important. Are there any other examples that you can think of, Kaylee, that would fall under this?
Um, well, earlier on when you asked if I'd done a group interview before, I realised right afterwards I actually have done a group interview before, but that was
Okay.
years ago. And I think
Yeah.
there was like a group task where we had to like build a tab or something like that out of newspaper, one of those standard sort of group task things.
Yeah.
And they stopped us halfway through and I said, oh, we didn't really care if you could build the tab or not. We just wanted to see how well you work together.
Yeah. Yeah,
So,
I had the same. Yeah, with job interviews, they love doing these. So just these ones are harder to practice, but in terms of groups, I just want to talk about one of the things I did to prepare was I went on Paging Doctor, and one of the things they had on Paging Doctor were these forum groups where people from Perth got together in small study groups, and you actually did interview practice together. I did this, and I did this early on. So whether people in the chat right now want to organize, because there's about 30 of you, so whether you want to organize small groups of you, depending on what your university is, and you can then, like, 5 or 6 is a good number. Any more than that is too much, I think, because you don't get a chance to talk. But we met every second or third night during the week at a central location. Yeah, we for a couple of weeks, and we would talk about answers. And yeah, it was a really good way to practice with other people. But again, you need to realize that again, what's important, you're still competing, but at the same time, you are valuable for each other, and other people have valuable stuff they can help you. So it's about overcoming that competitiveness. You still want to have it, but you can help each other get through. So that's a really good way. And the way to do it was through, for Paging Doctor was a website, if you're not already on it. It's a giant forum about everything medical school related and how to get in. You can go on their website, it's like pagingdoctor.org, I think it is. And they've got all these really
pagingdoctor.net.
.net. Thanks,
I
Kaylee.
may or may not
And
have it open in another tab.
fantastic. Okay, and so it's a way that you can go into all these threads. It's like the Reddit of med students, if that makes sense, where you can go and just have a look at everything else that people's ideas and other comments, and a lot of MMI situations and questions are available on that website, as well as things like GradReady do their. We have like banks of MMI questions, and there's also courses and other things that you've got in your handout. So let's have a chat about online interviews, because you guys are going into a new era of online things. So, just in general, you probably had to do this already, but in terms of when you think about job interviews, there's actually been quite a few articles written about how to do job interviews or big client interviews online through Zoom. Do a test run. You need to consider lighting. So, for example, if I look at mine now, my lighting is not good. So, I've got a light above me. I technically should have it like this, where the lighting is down and then I sit lower, and that can see my full reflection. Think about the equipment you've got. So you need to have an adequate speaker, camera, and you need to have good internet, which can sometimes be rare to find, but you need to be able to plan that, because it's going to come down to you on the day. And so utilizing a space at uni, booking out a like a study room at uni that you can book and not be interrupted would be a great way if you'd have poor internet at home. And trying to eliminate distractions. Only keep your interview up. Don't have anything else. Don't have, like, as much tempted as you are to have notes around you. Try and minimize the distractions. Keep your pets. Maybe take your pet on a family member holiday for the day. Get family members, just let them know that for a few hours you've got to do this interview, and you'd hope that they would be respectful enough to be able to say they'd move out of your way. If not, and you don't have that luxury, you need to go somewhere else. So go to uni, ask one of the people at uni, can I have this room for a job interview or a medical interview? And they should be able to organize something. Sit up, positive posture. So shoulders back, sitting back on the chair, feel like I'm back in like pre-primary. But again, it's small things where slouching like this and being small while you do it and trying to look at the camera is not going to come off well as someone else who's got just looks more commanding and more in control of their own environment. And then looking at the webcams, I'm making direct eye contact with you right now. Don't have that temptation to look at yourself. I know I've been doing it in this talk, but look directly at that webcam when you're
Or you
doing
could
it.
just stick the thing that has your picture in it next to the webcam, so you're
Good
basically
idea.
looking at the webcam when you look at yourself.
That's a good tip. That's a good tip with Zoom. So it's bang right underneath it, so it avoids that distraction. So any other things on there? The other thing is colors. You can Google this. Don't have patterns online have block solid colors, and things like red and other colors stand out a bit more, and also balance a bit better with the light. Like this blue probably is a bit light and it's making the contrast go weird. So it sounds silly and so specific, but it's all these little things that subconsciously the marker might not realize that it's affecting their judgment, but it's probably going to come into things.
Another thing as well, if you've recently been using Zoom to have like some party or social event, make sure to like change your Zoom. Make sure your Zoom name and your background are hunky dory before you go into the interview.
That's such a good point. You don't want to pop up and you've got like 50 golden retrievers in my background. I know I used to have that. So that's a really good point, Kaylee. Okay. So just online interviews, there's actually, so even in the short time we've had things shut down, people have, there's a lot of job interview techniques online about how to set yourself up. Okay. So the scoring. So to be honest, we don't have a lot of insight into this, but what the things that they have told us through medical school, and what I know they look for in good medical students once you're in, they look for your content, of course. They want to look at your appropriateness and insight of your response, as well as your structure. You could have no idea what's going on. Of course, you want to have a little bit, but if you have clearly articulated, you plan for change where appropriate with your structure, it's going to go better than if you just word vomit out things you don't know. And the biggest thing that can sometimes be the hardest to come across, show some empathy, show some of your personality that comes out, have a respect for diversity, and demonstrate that you actually understand others' opinions. So for example, in that the question about termination, I understand that people, not everyone's going to agree with me that she might want to go forward with the termination. So you need to have an acceptance that for some people that's not an option and it's not within their frame of what they want to do. Have an understanding of that, and then say, but based upon what I would experience and I would do, this is my understanding. And then presentation and manner, again, those are all the small things. So that's your how you dress, posture, your manner, and how you come across on the day. So any other bits that they would have on the scoring? I think empathy is huge, because that's the biggest thing they're looking for with medical students.
I think those are the sort of the main things. There might be slightly different criteria for the different stations that are testing slightly different things. But I suppose I think these sorts of criteria you'd be tested on them in basically every station.
Yeah. And I think in terms of, I think what I was going to say, empathy is the thing that's one of the hardest things to teach later. So it's a focus. Like we can, the medical student, what I've learned is I can learn the anatomy once I'm in. I can learn that once I'm in, but having the empathy and just a broader understanding of the world is something that you need to start before you get in. And that's what they're looking for, that you could learn all the medical stuff, but you're a genuine human being who's in here for the right reasons. That sounds like a Bachelor quote where they're like, I'm here for the right reasons. Anyway, next slide. Okay, so prep. So this is where the real stuff comes in. So research the different types of questions. Do a research day. Gather all the information you can from as widely as you can. Talk to previous students who've done the interview, who've gotten in, who haven't gotten in, and why they didn't get in. Any doctors, any people in the medical profession, nurses, allied health professionals, dentists, they had to sit interviews as well, podiatrists, anyone who has got a connection to the medical field, talk to them about it. GradReady. So GradReady has both information on the website. There was also interview courses that they have where you can actually come in and do MMI stations. Pagingdoctor.net is, again, the Reddit of medicine, where you can go in there and there's sub-threads for every single thing you can think of. The other thing I will say about Paging Doctor, it can become a bit of a like an emotional spiral at some points. People can get really stressed out on there, so just watch yourself when you go on there.
Especially when offers come out. You know when offers come out because you cannot log into Paging Doctor. The website just crashes because so many people try and log in at the same time.
We'll have a talk about I want to chat about after the interview once we've gone through this slide. So practice your responses, record and listen. So Kaylee, she mentioned liking, stop umming and ahhing and liking. Do this with peers and friends and anyone that you can, but get people who will give you genuine, honest feedback. don't get, I say this with the nicest intentions. Don't just get the nice friend, get your real critical friend. I got my sister. I love her. She's my sister, but she will give me honest feedback straight to my face. And that's what you want. You're going to deal with feedback through your whole medical career. So that's one of the skills to learn. It's about not being offended by what they say, that it's about taking what they say, unless it's really inappropriate, and then using that as constructive criticism. That's what's going to improve you. Use your mirror. Use one better than the mirror. Zoom, you can record yourself on the computer and listen. So that's a good way to do it. Anything else in there, Kaylee? Particularly peers and friends, you got any advice with that?
Not in particular. I thought that Zoom tactic that you had was a pretty good idea.
Yeah. So as painful it is to hear your voice and sit down and listen, go ahead and do it, because you're gonna thank yourself when you come out of the interview. Write down your responses for reflection, but don't memorize. With that point there, I would write dot points. I wouldn't write exact words. I'd write general themes. I'd be like, okay, so for this question, so the one we talked about with the ethical scenario, there was legal issues to do with the legality of termination and confidentiality of information. That's what the dot points I put under there. There was medical to do with her own health. There was social to do with the implications and consequences of disclosing a pregnancy. Have categories and general ideas about what was good. And then, for example, say, this worked well when I did this framework, but not the full-on answer. Do a dress rehearsal. Absolutely. Do things timed as much as you can. So for UWA, it's at 11 minutes, Notre Dame 6 minutes. Do your answers in the time for your university. And try to get to the interview location the day before. Just suss out where you're going. So suss out where you're going, parking, how heavy is the traffic going to be? Is there going to be anything on that day that's going to take away from you just focusing on your interview? So, for example, for me, what worked is if you can get someone that you trust to take you. Because I didn't want to drive because I was so nervous. So I understand that's not practical for everyone. People taking that, maybe driving is going to relax you yourself, but just having someone to be there with and just have there and also reassure you that you can do it is a really, really good thing before you go in. Plan what to say when you don't know what to say. That's a big thing, because that's the one thing you can plan. That can come across as maybe not fake when you say it. Like, so for example, when we did the health knowledge one, it's that I actually don't know a lot about the closing the gap situation, but what I can tell you about Indigenous health in Australia is this. Spin it to your advantage when you do those. Do you have any good phrases for that one, Kaylee? I find that really difficult.
I don't really have any good phrases, but I suppose it's just tactics, like with the ethical ones, just basically like listing all the people involved and the main issues. Um, that could be like your go-to when you don't know which way you want to lean.
Yeah.
And then also like, as we said with the health knowledge one, saying you're not really very sure, but based on the name, this is what you can sort of use about it.
Yeah. It's that even if it's not, you don't know the absolute specifics of it, you do know something. I'm sure you know something. That you've all reached the point where you're getting interview offers. You can do this. So you can just have that self-confidence is you need it. You need a healthy dose of that on the day, because that's what gets you through. You've done the GAMSAT and your uni marks. This is just the last hurdle, and then that's it. And then you're at that, like, you're on the final stretch of getting there. So you've done a really good job. Just final push to get there. So this is the selection criteria. This is a nasty looking slide, but if we break it down, so let's have a look. University of Notre Dame Frio, the minimum GPA that they had on their website is a 5. And
that's a minimum for them to consider you.
Yes,
generally people have higher than that.
Yes, so definitely it's the minimum GPA for consideration, as with GAMSAT 50%. They do give a rural Indigenous bonus, and they give the subquota, the postgraduate research. I think that's in terms of PhDs, I believe. In terms of criteria, what the percentage is, 33% GPA, it's three-way split to get an interview. So people from Notre Dame, you would have had equal weighting with your GPA GAMSAT portfolio. In terms of your final mark, what they have, so I'm just moving my screen, it's portfolio is actually not considered. So what they do is they then
You're looking at the wrong line.
sorry, I'm so sorry. I was on the wrong one. It's 50% everything, 50% portfolio. Sorry, I read the wrong one. I was going to say I was definitely the portfolio was considered. So what you then need to think is, at this point, consider the weight of the interview with everything else. But having said this, give everything a go. Give this 100%. That would be my advice. I know some people would be different. Kaylee might want to give some different advice, but this is the one bit you can control. So once you walk out of that interview door, it's done. You don't want to leave and saying, oh, if I'd done this, I should have done that. Don't leave it down to that. Do what you can now, and you can walk out going, I did everything. It's done. So in terms of UWA, this is the one I do know better, it's 50% GAMSAT, 50% portfolio, and then when you come out, it's a three-way split between the others. So the interview is pretty important. So anything, other comments about this, Kaylee?
Well, with the postgraduate bonus, I'm not sure about Frio, but with UWA, if you have done a PhD, that's considered an automatic GPA of 7. And I think a master's gives you an extra boost of 0.2 or something for your GPA.
Yeah.
So that's what they mean by the postgrad bonus for UWA. I'm not sure about Notre Dame.
Yep. Okay. And then the other thing with this as well is I just want to have a talk about what happens after you interview. Leave everything that once you've done the interview, come out and have a debrief. Write down what you did well and write down what you didn't do well, because as much as you don't want to, you might have to do this next year. So debrief, and then once you've done that, leave everything at the door, because you can't control anything. And for anyone who has an anxiety disorder, that can be one of the worst things for you. So it's about managing your expectations and your own mental health up until you reach offers. Because let me tell you, that was one of the most stressful periods of my life, purely because you have this such uncertainty. They don't even give you a date, which sucks. I think they should be a bit nicer with that. So you can't control anyone else. You can only control you and your own things in that, and keep that in mind. And that's what I mean when if you don't mind listening to other people talking about it and it helps you, go for it. But I would advise just stay away from everyone, the panickers. Stay away from the people going, oh my gosh, I have this GPA, I need this, all the calculations. For some people that might be helpful, but I think at this point, you need to find something to keep you busy. Distraction is a great tool. Do you have any points on that bit, Kaylee? I think you might be
I think it's very common, not just for interviews, but for a lot of other things that require performance. So I know, like when I play clarinet, and I know sometimes when I play clarinet at a concert or whatever, I think, oh, like, I got this bit wrong, whatever. Because, when you're in the moment, like you kind of pick up all these things because like the adrenaline's going through your brain and you're really thinking about all of it. So same with the interview, like when you come out, you're probably going to think like, oh, like I said too much in this one, or I said like too much in this station. And you're going to think about all these things and feel like you did a really crap job. But that might not necessarily be the case. Like you probably feel bad because you focus on it more because you are trying to do the best you can. But the examiner might not have noticed the things that you're freaking out about. I'm not sure if that sort of makes sense. But...
No, that's a really good point. It's just you're going to know what you did wrong probably more than the examiner does. Possibly.
Yeah.
So it's those small things. And it's also, don't sweat the small things, I think is what the summary of that is.
I think the main takeaway is that like it's not uncommon to walk out of a situation, like a high stress situation like this, feeling like you didn't do very well. But just because you feel like you didn't do very well doesn't necessarily mean that you didn't do very well.
Yeah. And just look after yourself when those offers come out, because you can get in, and I can tell you it was one of the greatest feelings getting the email of getting in, but then of course people don't get in. And so manage, and being able to be around people, manage what you're going to do if you don't get in, because it is. And also don't always consider second and third round offers. I know someone who got their offer on New Year's Eve And so they had a great New Year's. And it was right at the end. So it's really important. It's about having that hope, but it's about being realistic as well. So yeah, just look after yourselves. This is one of the most stressful things I did. But again, it's good practice because you're going to go into medicine with some very high stress situation. You're going to do OSCEs, and this is why they're prepping you for it. So in terms of what else we've got to look at, there's a survey on, and I think it's in your notes as well. Give us any feedback about what we could do for next year or any other information you want about the interview and what might be more helpful. And also keep an eye on the Facebook page because they often post up, there's so many videos on there. You can go back and view any of the GradReady videos about the GAMSAT, about general admissions into GemSAS, how to navigate the fun GemSAS website. So thanks, Kaylee. It's just been popped in the chat if you want to do that. And the other thing is that with GradReady, there's also a millennial scholarship where it closes 25th of October, and applying for this, you get a full GradReady attendance comprehensive course. So GAMSAT prep, and it's able to help you if you need a hand in that area. So yeah, thank you so much everyone for coming. Is there any final things you want to say before we end, Kaylee?
Not particularly, other than if you have any burning questions, please put them in the chat. Even if you put them in the chat a little bit afterwards, I think we still have access to the page. We'll be able to answer questions that you have.
Yeah, so anything, even if it's small, one thing with your outfit or one thing with this, just feel free to post it and we'll be in the comments after this. But yeah, good luck everyone. You can do it, and yeah, especially good luck for this year. I know things are a bit crazy, but you're almost there. And you can do it. It's having the belief you've gotten this far. It's about pushing right to the end. The sports metaphor is you leave it on the field. I think they say that in AFL a lot, where do everything in the interview and then that's it. So yeah, you can do this.
Find something nice afterwards as well, like something you can look forward to.
Yeah. If you like food, for me, mine was food. I was like, I'm going to eat this thing right after my interview. Go do that.
Yeah.
That's part of your interview prep. Thinking about where you're going to go afterwards. Yeah. Alrighty. So, we've got a question. Do you guys remember when you received interview offers? Was it about a month before when they are supposed to happen? Mine was early November. No, mine was Halloween. That's why I remember it because it was a very spooky day.
Wait, your interview offer?
No, interview offer. Mine was end of August 30th, from my memory.
Yeah, I think mine was mine would probably have been the same as yours.
Yes. So having said that, yeah, interview offers potentially aren't out yet. So yes, so once you do receive them, you will get a lot more information. Again, if you don't as well with interview offers, that's the same process of not getting a medical offer. Look after yourself in those periods and have a plan for what you're going to do next. So
I just checked my email, was the 30th of August.
30th of August, great. So yeah. End of August, and Notre Dame I think came out a week later, because normally it was, we sat ours end of September, and then I think Notre Dame sat theirs in the first week of October.
Yeah, it's probably because I have to get through everyone's portfolio and all the references.
Yeah, there's a lot more work into Notre Dame ones. Anyway, so any other burning questions on there? So yeah, I feel for you guys who haven't got your interview offers yet. This is again another stressful period. Anything else? Alrighty, well in that case, thanks everyone for listening in. And if there's anything else that you more information, feel free to get in contact through GradReady through the website. And thanks for listening.
Thank you, everyone.
Alrighty. Thank you.